So, studies showed benefit for a range of creative activities for a wide variety of conditions, including trauma, sexual abuse and other kinds of trauma, depression, schizophrenia, body image disorders, eating disorders, dementia, chronic pain, fibromyalgia, and cancer. There were studies that I read about poetry for failed suicide attempts, art for self-efficacy in adolescents, writing for pediatric oncology patients, art for dementia, art for depression, music for emotional disturbance, dance for depression, gardening for depression. The list goes on, and every study I read had some positive benefit. So how could I choose which ones to share? So one article that I really liked was called Arts in Healthcare, A New Paradigm for Holistic Nursing Practice by Mary Rockwood Lane, who's a nurse practitioner in Florida. She helped found this program called Arts in Medicine at the University of Florida with John Graham Pohl, who's a pediatrician and poet and prominent leader in the healing arts. And this article just describes the process that she went through, and it interested me because of my interest in making art therapy programs happen. So in this article, she describes the history of art in hospitals from initially something to look at that they discovered around the 60s that, oh, you know, let's make hospitals a little bit more fun. So they put up some art. And then they started realizing, oh, well, actually the structure of the hospital might contribute to a healing environment. So they started making these really interesting buildings, such as the Children's Hospital in Houston has this huge circular atrium, and you know, all these innovative designs started coming up, and they started putting gardens in hospitals and fountains and different environmental aspects. And then they started doing performances in hospitals, such as piano that we had here just last year, I believe, and they had that in my medical school, and people playing harp and various things. And then finally to bedside art programs. She talks all about the process of getting this up and going, which is very interesting. And what's going on at the University of Florida is they have these artists in residence. So they invite different artists to be a part of their program for different periods of time. And they have a whole panel of people working there, including poets. They have a barbershop quartet, pianists, puppeteers, two-dimensional like painting and three-dimensional sculpture, visual artists, plus a whole separate section devoted to imagery, meditation, biofeedback, and mind-body education. So you can actually consult this team in the hospital and have them come to the bedside and educate your patient about meditation, do a guided imagery with your patient, and they work in the peds department, OB-GYN, they go to births, they do serenade people in the halls. It's really quite unbelievable. So a take-home point of this article is that hospital stays are shortened and pain medications are needed less when creative interventions are available to patients in an inpatient hospital setting. And that's the website, if you're curious. It's shans.org, AIM, Arts in Medicine. So, a token randomized controlled trial. Art therapy improves coping resources, a randomized controlled study among women with breast cancer. This is from a university in Sweden. So some details about the study. It's kind of small, so that's a definite limitation. 20 people in the study group, 21 in the control. They used a scale called the CRI, Coping Resources Inventory, to measure coping skills and strategies. The study showed statistically significant improvement, specifically in the social domain of the CRI in the treatment group versus control. Social domain measured extent of embeddedness in social networks that could provide support during stress. So some thoughts that I had about this was that if coping is defined as flexible, realistic thoughts and behaviors that help solve problems and reduce stress, then it seems only natural that artistic work, which encourages and strengthens creativity, which in itself is about novelty, flexibility, and appropriateness, would improve coping resources. Given their own personal time for reflection and integration, women developed their ability to rely more on others. That was sort of interesting. So it's fascinating, as it has been shown that solid social networks improve survival and quality of life after a cancer diagnosis. So one more interesting study is a randomized controlled trial of mindfulness-based art therapy for women with cancer. So it incorporates elements of mindfulness-based stress reduction, which I've personally trained in with John Kabat-Zinn from the Center for Mindfulness in Massachusetts and art therapy. So the goal is to provide skills for self-regulation, not confined to the verbal domain. So not just about talking. Tools to help patients witness, interpret, and manage their objective and subjective representations of their illness. The belief is that making art may activate right hemisphere, leading to increased awareness of emotional responses, especially related to threatening events such as trauma or cancer diagnosis. The project also included a verbal articulation stage where patients described their images and what they represent. So this was more of a left hemisphere part of the activity. So both hemispheres of the brain are integrated and coordinated in this kind of approach. This bilateral hemispheric integration has been proposed in previous studies to be an integral feature of resolution of past trauma. As mentioned before, integration between two hemispheres is a key component of creativity. So some details about the study. 55 people in the waitlist control group and 56 in the study group, all active cancer patients. 8-week program. There was a 16-week follow-up. And they used an SCL-90R rating scale, which was a symptoms checklist revised rating scale. 50% of the patients had breast cancer. So the results, there was a statistically significant decrease in symptoms of distress measured by the SCL-90 depression and anxiety scales. There were subscales related to hostility, obsessive-compulsive traits, interpersonal sensitivity, and somatization that were also significantly improved in the intervention group over control. The conclusion was that the mindfulness-based art therapy is successful at helping patients lower distress levels and improve quality of life. One of the ways this happens is by shifting patients' focus to a life perspective that is broader than one that defines them as a cancer patient. And it was also notable that at the 16-week follow-up, all of the benefits were still present. They hadn't diminished at all. So what can you do? Incorporate into your work or refer. A few ways you might incorporate this into your work include encouraging journaling, asking patients about dreams, suggesting a sketchbook, or asking your patients what they're already doing that's creative. I had a really interesting experience with a patient last week. I was, kind of getting ready for this talk and thinking about how, despite being so interested in creativity, unless my patients bring it to me, I don't often just start talking about it with them. So I brought it up with a patient that I'd never talked about it before, and his energy totally changed, and he got so excited and told me he used to draw in college, and he was going to go back to it, and he was going to, bring in some artwork, and it just totally shifted the whole dynamic between us. And I'd been working with him for a year and a half, and I'd never seen him take on that kind of pride or pleasure, so it was really interesting. So help them cultivate what they're already doing. It might be gardening, cooking, poetry, sewing. Support them in their efforts to nurture a creative hobby. Reinforce the importance by asking them about their work or having them bring something in. Encourage patients to think and talk about what the art, garden, meal, music, poem, etc. means to them. And then there are things like little exercises that you can do, kind of like what we did today, or one is really popular called Morning Pages that came from a thing that's called the Artist's Way. That's a popular creativity development program. But Morning Pages are just every morning. For about 20 minutes, you get up first thing, you have a journal, and you just write whatever comes out without any censorship. You can't go back and change any of it. You're not supposed to really even look at it. You just write everything that comes out. You can also do what I call daily doodles, and I try to do this with my non-dominant hand. And sometimes I, use chalk and just things that are hard to be precise with, so it's a lot more just about getting into the other hemisphere. So you want to make it happen often. Try to do something every day. Try to make it fun and more about the act of creating than a polished product to minimize self-censorship. So some resources, and I don't know if you guys have a handout, but these aren't in there because I just added them today. So apologize for that. I could send them out to everyone on email. But the Southern Arizona Friends of Jung has a list of some people who are art therapists in town on there. The International Expressive Arts Therapy Organization does different conferences, and their website's in development, but it eventually should